And welcome back to The Factor Uncensored. In the midst of planning your New Year's Eve celebrations, which is right around the corner, you should also make sure you plan some time to do your final doctor's visits before the end of the year. Dr. Danish Ali with Archpoint Pain Institute talks about how you can get the most out of your health insurance. Dr. Ali, we always hear the push in advertisements on radio, on TV, where dentists are saying, get those last minute benefits in before the end of the year. But there's also something else if you have health care and that deductible, if you've met that deductible. Explain that to us and how that could be beneficial to someone who may have insurance.
Right. So Isaiah, so insurances have a deductible amount that you have to reach in order for the insurances to start covering or paying for a percentage of whatever services it may be, right? And so folks, as the year progresses, are able to hit that deductible, are able to hit that amount. And what happens is after that, the insurance starts covering a majority, if not all of the percentage of whatever that service may be. Therefore, our recommendations, especially if you have been putting off some things like some imaging studies or some x-rays, MRIs, colonoscopies, or things that are of potentially high cost, for you to consider getting those done before the end of the year, because if you've already met that deductible, then the insurances are going to be paying a higher percentage than they would otherwise at the beginning of the year, let's say.
What would be your advice to someone who wants to get in and see that specialist? And it may be, they may book you out into 2024 and you miss the opportunity. Do you shop around? Do you check with other doctors and clinics around? How do you get in before the end of the year?
Yeah, Isaiah, it's always important for you to talk to your primary care doctor first. They are the gatekeepers of kind of knowing your comprehensive health information. And they may be able to guide you better. Yes, it's okay for you to wait that period of time, or no, this is something that may be a little bit more urgent that needs to be addressed before the end of the year. They may be able to pick up the phone and call one of their colleagues or somebody that they may know that they can kind of get you in a little bit sooner than otherwise. And so I think it's a case by case. It depends on what the topic is or what the issue may be that may be going on, and I think it behooves you to talk to your primary care doctor first, make sure that they're aware of what you're requesting or what you're needing, and then they can help guide you as to, yes, this is something that needs to be done urgently within the end of the year, or something that can be put off. There are cases, Isaiah, that folks have gone in to see their primary care doctors and realized that this is something that needed to be addressed yesterday, and those doctors will then send them to the emergency room immediately and start the process sooner than later. So I think don't leave it. I think it's something to have a discussion with your physician about, and then decide accordingly as to what the next plan should be.
And Dr. Ali, what if you're one of those people who don't have any pressing issues or medical problems that you feel like you need addressed? What would you recommend if they've met that deductible in their insurance? What types of procedures or tests would you recommend just to keep a handle on your health that they should get at the end of the year or before the end of the year using those insurance benefits? Because obviously we don't want to leave any money on the table.
That's correct. Yeah. So Isaiah, I think it goes case by case again, depending on your age, other risk factors, family history, other medical illnesses that you may have, or even folks in your family that may have other histories. And so it's hard to answer that question without individualizing each patient. However, having said that, I think it's still the most important thing is to talk to your primary care doctor. They can do what they call an annual physical exam, annual check to see, are there specific things that we need to get done? It may be checking your blood sugar, your cholesterol, your blood work in general, your thyroid function, your cholesterol function, all of these things. However, it needs to happen individualized for each patient, and that treatment needs to be tailored by their primary care doctors.
Got it. And for women, when I think about women, and there could be possible cancer in the history of their family, mammograms Or will they be covered by the insurance once you've met that deductible? Or is that something that, many agencies provide free now?
That's correct. A lot of times, Isaiah, this is considered preventative, and so it is covered regardless of what portion of the year you're in. And again, as we've been saying, primary care and that OB-GYNs for females also falls in that realm as well. And so if you're a female and it's important for you to see your OB-GYN as well.
All right. Dr. Danish Ali, thank you for your time. We appreciate your expertise, sir.